The pace of COVID vaccinations in the U.S. is steadily rising. According to the CDC, more than 27 million Americans have now gotten at least one shot. But some rural areas in Virginia are being left behind because of how the process is designed. Our lead national correspondent, David Begnaud, traveled to Wise County in the southwestern part of the state. David, good morning.
Anthony, good morning to you. Appalachia couldn't be prettier or poorer in some places. We came here to tell the story of what is essentially the little guy asking for a seat at the table. Health Wagon has been servicing this part of the area for decades, and they give their services for free. Some of these patients are coal miners. They have black lung disease. There are tons of pre-existing conditions among people who live here. They are among the most vulnerable in the United States, and they have not gotten a single dose of the vaccine.
Y'all wear your mask and stay safe, okay?
The heart of Appalachia beats with the help of nurse practitioner Teresa Tyson.
How long did you work in the mines?
32 years.
32 years.
She runs the Health Wagon, the mobile medical clinic providing crucial health care to low-income and underserved people here in southwestern Virginia.
They don't have reliable transportation. They don't have the money for fuel to go to a clinic.
For 28 years, Nurse Teresa has navigated these rural roads of Appalachia to service those who otherwise may not get any medical care. What they need now, she says, is the vaccine. The Health Wagon services 2 health districts in the state. Those districts account for about 2% of Virginia's population. And this week, they received about 2,100 doses out of the approximately 120,000 vaccines allocated to the state. Now, that's just under 2%.
How about the COVID vaccine? We are trying to get that.
Health Wagon, which has more than 5,600 active patients, has not gotten a single dose. Instead, they've gone to mostly local hospitals, local health departments, and long-term care facilities.
I'm just desperate to get the vaccine for my people.
We went to Dr. Danny Avula, the state's vaccine coordinator. He told CBS News there is not enough doses coming from the federal government to distribute to everyone who wants it.
A month or 2 months from now, as new vaccines come on the scene, we'll be able to start feeding all of these channels of providers and pharmacies who can get out the vaccine at large scale.
As of today, Virginia is deciding who gets vaccines based on population. But Nurse Teresa says that's not fair. Appalachia is more rural, but the need is enormous.
Vulnerable populations need to be a priority in receiving this vaccine. They have chronic health conditions. They actually live 10 years less than our counterparts on the eastern shore of Virginia.
And they're poorer here. Health Wagon says the poverty rate of the area it services is 54% higher than the rest of Virginia. Is there something you can do to get vaccines here for them quick?
Absolutely. It's called more doses.
He is Virginia's governor, Ralph Northam, who himself is a doctor.
Right now, David, we're getting about 120,000 doses a week. We need about 350,000.
Most of what I heard is Teresa's doing great work, but she just needs to be patient. What do you say?
Oh my gosh, I can't be patient. I have to be a voice for the people that do not have a voice here. How can you be patient in a pandemic when people are dying?
Bottom line, West Virginia needs more doses from the federal government. Most states do, or the states need to be able to buy directly from the pharmaceutical companies. Let me be fully transparent. When the governor of Virginia found out we were coming here, his staff called CBS News and said the governor wanted to be a part of the story. I interviewed him, and I thought he was going to say he was sending doses here. He didn't. But Gayle, Nurse Teresa is optimistic. She says with the governor now on notice, so to speak, he knows what they need, and she thinks he'll help get something here soon.
No, I think she has a point. I think she has a really good point where she said, how can you be patient in a pandemic? People are dying and you're afraid. Thank you, David. But something tells me the governor will figure something out sooner rather than later. Thank you.